Thomas, and I'm a nursing student, and today I'm going to be conducting an exam on your head, your eyes, your ears, your nose, and your throat. Okay. But before I do that, can I verify your name and your date of birth, please?
Chris Wheeler.
When was your birthday?
February 4th, 1998.
Great, thanks Chris. Do you have any allergies?
No.
No, that's good news. So like I said, today we're going to be doing some different things that'll involve me touching your head, it'll involve me looking with the light in your nose and your eyes, your mouth. And then I'll also have to feel your head, feel different lymph nodes, so it's like a lot of touching in your neck.
Okay.
If you're uncomfortable at any point or if you have any pain, just let me know and we'll stop, okay? General appearance, patient is in overall good hygiene, male, he is sitting in an upright position. There's no obvious signs of pain, no obvious signs of respiratory distress. He is awake and he is alert. He's able to answer questions without any deficit or any confusion. His face shows no obvious sign of drooping. His eyes are symmetrical. Everything looks and appears to be good from my first appearance. So Chris, to start, I'm just going to ask you a bunch of different questions and answer to the best of your knowledge, okay?
Okay.
The first thing I have is, do you drink any alcohol?
No.
What about smoke cigarettes?
No.
Do you use recreational drugs?
I do not.
Okay. Do you feel safe at home?
I do.
Oh, good. Okay. So those are just kind of helping us to understand your risk factors for different things.
Okay.
Now we'll move on to some more specific questions. Do you ever suffer from migraines or headaches?
I do not.
Okay. What about family history? Do you have a family history of those things?
Not that I know of. No.
Okay. Do you have recent fevers, chills, anything like that?
Nothing.
Okay. Do you have any neck pain or jaw pain?
I do not.
Good. Do you have any recent dental work, or do you need to have any dental work coming up?
I do, actually.
You do? What do you need to have done?
I need to have I've got a missing tooth here.
Okay.
Bottom left molar.
What caused that tooth to be missing?
Cavity.
A cavity. Okay. Do you have any pain in that area right now?
I do not.
Okay, good news. Do you have pain anywhere?
No, ma'am.
Okay. Ears. Are you having any ear pain at all?
No.
Are you experiencing any dizziness?
No.
What about any blurred vision or like seeing fuzzy things in the okay. Good. When was your last eye exam? Do you remember?
It had to have been at least 7 months ago.
Oh wow, that's pretty soon. Do you need glasses at all?
I do not.
Okay, good. Thank you for answering all those questions. So now we're going to go ahead and just begin our assessment.
Okay.
First thing I'm going to do is look at your head and feel it with my hands. Is that okay?
That's fine.
Great. Tell me if anything is tender or if it hurts. Anything hurt?
That's fine.
Okay. So the head is midline. There's no gross deformities. There's no masses present. It's non-tender palpation. The hair is evenly pigmented and evenly distributed in a male fashion, both on the face and on the head. There's no signs of skin breakdown on the occiput, but that all looks good. Looking at the neck is also midline, and the trachea looks midline as well. So the next thing we're going to go ahead and do is I'm going to go ahead and feel your nose. So let me know if it hurts when I push on your nose. Okay. Does that hurt at all?
No, no.
Okay, no tenderness upon palpation of the nose. It appears to be straight and midline. There's no obvious deformity there. There's no obvious lesions or erythema. There's no obvious swelling on his nose. No drainage either. I'm going to push on your sinuses, so that's right above your forehead and a little bit further down your cheeks, okay? Let me know if there's any pressure or pain here.
None.
No? Okay, now I'm going to go ahead and push your sinuses here.
That's fine.
Okay. There's no tenderness upon palpation of the sinuses. That all looks good. There was no swelling. It was not filled or anything like that. So that all is normal and good. The next thing I'm going to do is look up your nostrils with my pen light, okay?
Okay.
So I'm just going to have you tilt your head up for me. I'm going to go ahead and look in this one first. All right, good. Now I'm going to come to this other side and check this one. Okay, good. So there's no excessive drainage. There's no bleeding noted. They're pink, moist, but there's no excessive drainage. There is slight hair growth, which is normal and expected for his age. There's no foreign object. There's no blockage or anything like that. So that looks good. Now I'm going to go ahead and do some similar things with your eyes.
Okay.
First, as I'm just looking, the sclera is white. There's no erythema there. The conjunctiva is normal. There's no jaundice or icterus. Everything looks normal. There's no discharge noted, so that's good. I'm going to go ahead and use a pen light on your eyes, so it'll be a little bit bright, but just look straight at me.
Okay.
Okay, ready? Good. Good. So the pupils are about 4 millimeters. Without the light, they shrink down to about 2 millimeters, which is normal. They're equal and reactive to light. They're both round. They respond at the same time. So when the light is being shined in one, the other one responds simultaneously, which is a good sign.
Okay.
There is no delay in that or anything like that, so that's all normal. Like I said, his eyes are symmetrical. They're both round and they're just evenly placed. There's no obvious like involuntary movement of his eyes or any other facial muscle, so that's good.
Okay.
The next thing I'm going to do is go ahead and look at your ears. So first thing, I'm going to feel them. Is that okay?
That's fine.
Okay. Again, let me know if it hurts at all. Any tenderness?
No, that's fine.
Okay. I'm going to go ahead and use my pen light to look.
Okay. You may see some scarring from past ear infections.
Okay. Scarring from past ear infections. Do you still get ear infections often?
Not often. Not as often as I used to.
Okay, I'm going to pull on your ear just a little bit. Like I said, let me know if it hurts. Okay, good. I actually don't see any scarring. The ear canal is normal. I can see straight in there. There is slight hair growth, again, expected for his age. There's no foreign object. There's no discharge at all. No erythema, and there's no even like buildup of serum in there. So that's all good and normal. I'm going to do the same thing to the other side now.
Okay.
Again, I'm going to feel. Any tenderness?
No pain.
No pain. Okay, so there's no pain to palpation of either ears. I'm going to go ahead and look with the light again.
Okay.
Same thing, just slight tug here. All right, this is the same situation. There's no erythema, no foreign object noted. There's no cerumen buildup. The tragus on both of his ears is just slightly lighter in skin tone than the rest, but there's no erythema, no concerns there. So there's no piercing, there's no evidence of scarring. So that's all normal. The last thing I'm going to do with the light is going to be looking in your mouth.
Okay.
So I'm just going to have you open real wide, and I'm going to look to the back of your throat, okay?
Okay.
Go ahead and say ah when you're ready. I'm going to have you tilt your head down just a little bit. Go ahead, ah. All right, good. So the tongue is pink. It has papilla present, but just not an excessive amount normally. The mucous membranes are moist. The pharynx is also moist. It's not erythematic or anything like that. There's no obvious lesions or pus or anything like that present. His tonsils, have you had your tonsils removed?
I have. Yes.
Yeah, his tonsils are a grade 0. I don't see them present, so that is to be expected with his removal. Did you heal normally from that
Yes.
procedure? Good. Okay, good. So that all looks normal. His dentition is all good. There's no obvious dental work. Like he said, he does have that missing tooth. But other than that, it looks good. He said there's no pain reported with it, and there's no signs of infection there. So that all sounds good. The next thing is going to be those lymph nodes that I was talking about. So I'm just going to go through a bunch of different spots, and I'm feeling for any hardness or anything like that. Please let me know if it hurts or if it's just uncomfortable, okay?
Okay.
Should be a little bit of pressure, but that's it.
That's fine.
So the first ones we're going to start with are your pre-auricular lymph nodes.
Mm-hmm.
And those are going to be right in front of your ears here. So I'm just going to go ahead and feel. Okay. Now I'm going to do your post-auricular, which is behind your ears.
Okay.
I'm sorry, my hands are a little bit cold.
It's all right.
Okay. Good. Now I'm going to go ahead and move to your occiput. These are just like the back of your head here.
Okay.
Okay. Good. Next up, I'm going to do your posterior and anterior cervical chain. So anterior is the front. I'm just going to go down your neck a little bit, okay?
Okay.
Okay, now I'm going to do the posterior cervical chain, which is just behind.
Okay.
Okay. Next up, I'm going to do your tonsillar, which is kind of like under your jaw a little bit.
Okay.
I'm going to go ahead and just look right here. Okay, and then your submandibular, which is going to be just a little bit more inner.
Okay.
Okay, any tenderness there at all?
No.
And then submental, which is right underneath your chin. Okay.
Okay.
Good, and then the last ones are your supraclavicular. So I'm going to have you shrug your shoulders for me.
Okay.
And then I'm going to come underneath your straps and just kind of push right in here.
Okay.
All right, good. Was there any tenderness or any tightness or anything like that?
No.
Oh, good. Okay. All lymph nodes were not palpable. They were not filled with any fluid or anything like that. No hard masses, anything like that. And there was no tenderness upon palpation. So based on everything, we don't need to further investigate. Do you have any questions for me?
I do not.
Well, thank you for your time, Chris.
Yes, thank you.